I think we're live. Hey, Scott, how are you? How are you doing today?
Hi, Brian. I'm fantastic. How are you?
Good. I just want to welcome everybody in our audience today. I think I'm looking at the number of participants and it's skyrocketing. We're heading up over 700. Everybody, as you get settled in, if you could all just look at the chat button at the bottom of your screen and tell us where you're from, everybody. Whoa, unfortunately, I can't read that fast. Slow down. Whoa. See, Ohio, Las Vegas, Virginia, Colorado, Florida. So pretty much all over the
Calgary,
country. I'm seeing some people from overseas,
England. Yeah, look at that. Greece,
San Diego,
Brazil,
California.
Japan. Wow, Australia, Switzerland.
I told you, Scott, we don't mess around at Forks.
No, you
We got serious
have an
people.
amazing community.
All right, well, welcome everybody. I think we're gonna kick this thing off. So hi everyone. Welcome to our webinar today, titled "How to Stay Healthy During the COVID-19 Pandemic." My name is Brian Lindell, and I'm the founder and president of Forks Over Knives. I know many of you, like us, are struggling with the realities of COVID-19 and the health and financial uncertainties that come with it. We believe it's important to support each other during this difficult time. On behalf of the Forks team, I'm very grateful you're here. Your trust in us means a lot, and we don't take it for granted, not even for a minute. We are committed to always earning your trust by bringing you the most accurate, healthy lifestyle information out there with webinars and other content from the leading experts. To that end, I'm pleased to be joined here today by our featured medical doctor and my very good friend, Dr. Scott Stoll. Dr. Stoll is co-founder of the Plantrician Project, the International Plant-Based Nutrition Healthcare Conference, the International Journal of Disease Reversal and Prevention, and the Regenerative Health Institute. He is a member of the Google Food Lab and served as a member of the Whole Foods Scientific and Medical Advisory Board. Dr. Stoll is a published author and member of the 1994 Olympic bobsled team, and he's also a highly sought after international speaker. He lives with his beautiful family in Bethlehem, Pennsylvania. Let's face it, coronavirus has disrupted our world, leaving many of us feeling vulnerable and fearful. The good news is there are concrete steps you can take to support your immune system and emotional well-being during this unsettling time. We want to make sure you come out of the other side of this crisis strong and healthy. Today, Dr. Stoll will discuss practical strategies for taking care of yourself in the age of COVID-19. We'll be doing this in a Q&A format. I'll kick off the webinar by asking Dr. Stoll a few questions, but really today's webinar will be about your questions and concerns. Our team members have gathered some of your questions from social media. They will also be monitoring the chat and Q&A boxes at the bottom of your Zoom conference window. So ask your questions away in those boxes, and we'll get to as many of your questions as we can. Please note that Dr. Stoll cannot answer personal medical questions. Now, without further ado, I'm pleased to welcome Dr. Scott Stoll. Dr. Stoll, welcome.
Thank you, Brian, and to your team, thank you so much. And to all of you, it's such an honor to be with you today, joining this amazing Forks Over Knives community. And Brian, kudos to you for building community, because community is so powerful. It's really together that we can affect change and support each other during challenging times like this. So it's really an honor to be with you. And I just want to say briefly to all of you that are watching and to your families that on behalf of my family and the Plantrician Project family, we know this is a challenging time. It's affected all of us. It's affected some of us with the disease, but it's impacted all of us financially and with our work. And our compassion and concern go out to all of you, and you're in our hearts and our thoughts and our prayers.
And we also, of course, echo that sentiment for myself, my family, and our extended Forks Over Knives family and team. So thank you, Scott. So let's jump right in. I really want to start with the basics. So what is a virus, And how does COVID-19 differ from other viruses like the flu?
Yeah, thank you, Brian. And I actually went back and spent a lot of time doing some research on this COVID-19 so that I could really understand it as well. You know, viruses are not a living substance, but they reproduce and they can cause disease in humans and animals. And it's interesting, this coronavirus is a common strand of viruses that we find frequently in animals. And some of these viruses can mutate and leap from animals into humans. It's called the spillover effect. They're also called zoonotic viruses. They start in animals and then can end up infecting humans. And that's what we're seeing here with this COVID-19. It's a part of a family of viruses called the SARS-CoV virus family. And this one apparently mutated from the Wuhan family, or Wuhan animal markets, and leapt from, at least now they're thinking from bats into humans, but more of that research is going on. There's actually an excellent publication that just came out in Nature on March 17th, 2020, that studies the DNA tracing of the source of this COVID virus back into the Wuhan markets. And I would highly recommend that. We can maybe include that link. I'll send that to you, Brian, if people are interested in reading about that. So this family of viruses, then there are lots of general viruses that do not cause severe illness, but this COVID-19 virus appears to be much more highly infectious even than flu virus. You know, we had the epidemic in 2009 with the H1N1, which was kind of a global pandemic. And with the H1N1 and the spread of the flu, they were not able to contain that early. And so that we didn't experience the same level of containment and shutdown of the world that we are experiencing with COVID-19, because they were able to identify it early, and they believed that containment would be able to preserve the necessary medical resources. So that's why this is kind of a first unprecedented event for all of us with an infectious disease. Now, what's really interesting with this COVID-19, because it is much more infectious than the flu, we see a more rapid spread. And I was just reading in some interesting statistics that with the flu virus, the spread is about 1.4. So if I were to have the flu, I would spread it to about 1.4 people. And if we did that 10 times, we would end up with about 14 people being infected if I were carrying the flu. Now, what's really interesting with the COVID-19, we see that it has an infection rate of about 3. And so if we play that out again over 10 spreads, that equates to about 59,000 people if we do the math correctly. And so that's why we see this rapid spread across the globe, because it is highly infectious. It's not maybe as virulent as the SARS or MERS that we saw 20 or 30 years ago, where the death rate was 10 to 20% on some of the SARS and MERS. But we are seeing a higher death rate, especially in older populations with this disease. Now, just to step back, you know, we're going to be reviewing some data, and data will help put some, I think, some clarity on what we're facing. And I'm really hoping that the data will bring some a dialing back of fear, because we see a lot of fear-based projections in the media today, and they really are only projections. This is all playing out. We don't have the data to verify those projections. And so I don't want to talk about any projections. I'm just going to talk about what we know now. And in a year from now, we'll really have a much better understanding. And then I don't want to play into fear, because fear does not do us any good, as we're going to talk about a little bit later. So, you know, as we try to understand a little bit more about this COVID virus, we can see that currently there's about 362,052 people that have been affected worldwide as of today, with about 15,000 deaths and 11,000 serious people in serious condition. In the United States, we have about 40,000 cases and 400 deaths to date. In February, on February 24th, 2020, JAMA published an article looking at death rates and found the death rate of about 2.3%. The WHO has just published a recent death rate of about 3.4%. But what's really interesting, when we kind of look at the death rates of this, we can see that it's much higher in the older populations and the people that are fighting other chronic diseases. We see in the population of 60 and older, about a 3.6% death rate. In the population that's 70 and older, the death rate's about 8.6%. and the 80 and older, it's about 14.8%.
Mm-hmm.
Now, when we compare that with the flu, we see that the flu deaths in the 80 plus population is about 0.83%. So it appears to be much more virulent and deadly for those older populations. What we're also seeing today with the virus is that people that have heart disease, hypertension, chronic lung disease, diabetes, cancer, and are immunosuppressed, and that can be through medications like prednisone or immunosuppressants for autoimmune diseases, or through cancer treatment, but those populations appear to have much higher death rates and much higher rates of acquiring the disease. And so I think it points, especially for this Forks Over Knives community and all of us in the lifestyle medicine and food as medicine community, the importance of being well and maintaining a healthy diet, that when we encounter diseases like this, infectious diseases, and this will not be the last in our lifetime, but if we are able to reverse those diseases and to be healthy, the likelihood of being impacted by viruses and infectious diseases is much smaller, and the likelihood of being seriously impacted is far more insignificant. So I think that it's really a highlight to the work that you're doing at Forks Over Knives, the work that I'm doing, PCRM, Michael Greger, Nutrition Facts, everybody's doing to educate people on being well, because it really dials back the risk of those diseases. Just a few more statistics that I want to cover before we move on to the important stuff, which is how to be healthy. But, you know, if we look at also some of the data that came out of South Korea, it gives us a little more hope. You know, they're the only country that is tested countrywide, and they were doing drive-by testing and were able to test 180,000 people in their population. And they found that their current death rate is about 0.84%. And I think we're seeing higher death rates in the US and other countries because we're really testing the symptomatic people and those that are seeking care, but we're not testing the general population. And what we're seeing in the general population is that at least 80% of people that acquire this disease is very mild. Some people don't even know they have it. They're asymptomatic carriers, and it doesn't impact them significantly. So, you know, I think that's some important information for those of us that are healthy. Dr. Tony Fauci, who's the director of the NIH Allergy and Infectious Disease, who's heading up the national response in the United States, believes that in the end, the overall death rate will be about 1%, which is still higher than the flu, about 10 times. But it's much lower than some of the projections that we've seen in the media. And I think that's important to kind of dial back those projections again and go based upon the data that we have right now. And then just finally, just for you all that may be concerned about getting this, you know, the typical symptoms that you might face when you encounter COVID would be a fever, chills and aches, and it tends to be much more related to respiratory symptoms. So that would be cough, shortness of breath, and pneumonia type symptoms. So those are the common symptoms that may differentiate it from the flu, where you would have fever, aches, and chills, but not as significant a respiratory impact. And the times to seek medical care are when you're experiencing significant shortness of breath. You start to notice bluish color of your lips or your nail beds, which would imply that you're not getting enough oxygenation through your lungs, or you're really struggling to breathe, or you have those symptoms and one of those significant other concurrent conditions like heart disease, cancer, diabetes, hypertension. It would be important to seek care earlier rather than later to receive the best treatment in our hospitals. And for most of us, it's not necessary to seek care immediately, but if we experience those symptoms, to certainly quarantine ourselves to prevent others from getting receiving that disease from us or us being a carrier. So if we have that, it's our personal responsibility to the community to just dial back in our house for at least 14 days, maybe 21 days, take good care of ourselves, drink a bunch of green smoothies and eat a bunch of kale, and rest and recover with good fluids. So I think I'll end there, and we can, you know, add more content around that framework through our conversation. But I just wanted to lay out some of the framework so that we have a better understanding of what we're facing.
Well, thank you, Scott. Thank you for that answer and for bringing us up to speed with where we are at today. And, you know, kind of as people that are into the lifestyle medicine side of things, I think a lot of people in our audience are really concerned about, like, what do I do to build my immune system up so that maybe I don't get it, or if I do, I kind of minimize the symptoms. And of course, we're all concerned about the idea that that we don't want to spread this to others. So my next question to you is, what are the basics for building a better immune system?
Yeah, and that's really important. And that's kind of the hope-filled lining, I think, of our conversation today, is there's so much that we can do to take back control in our own lives with our lifestyle choices to improve our health, the health of our loved ones, and the health of our families. And so, you know, just kind of a basic big picture of what we can do to improve our immune system. You know, ground zero for our immune system really is our microbiome. And the more information that comes out every week in the literature, the more we see that our lifestyle choices impact the health of our microbiome. And so the microbiome are the, 50 to 100 trillion bacteria that live in our gastrointestinal system, most of those in the distal part of our GI system, that are impacted by lifestyle choices like food and habits and stress and exercise and sleep and toxins in our environment. And when we have a healthy microbiome, it impacts the health of our immune system by at least 75%. So the microbiome's health directly is related to the overall health of our immune system and increases our body's ability to fight off infections like COVID-19. Some of the important aspects that we'll talk about in a little more detail are the foods that we eat. And we see that when we're eating an animal-based diet or a processed food diet or sugar, those things can shift the types of bacteria that live in our gut within 24 hours. And over the course of 3 days, we can see a significant change in the types of bacteria that live in the microbiome. And those bacteria, especially when we're making the right choices, help to improve our cellular and humoral immunity, the types of the immunity that fight infections. And we'll talk more specifically during the rest of our conversation about what types of foods are relevant to improving our microbiome. We also see in some research that fermented foods, in one interesting randomized control trial, that eating fermented foods, like just actually at lunchtime, I had beautiful green salads from some salad greens we grew in our house with fermented beets on top and mushrooms, all good to help boost your immune system. But those fermented foods, even in that randomized control trial, directly increase the number of bacteria in the gut. And in this randomized control trial, they saw that the fermented foods increase the serum IgA levels, which potentiate the immune system to fight infections. So adding fermented foods, and I really have gone to adding fermented foods on my salads as a salad dressing as a way to get fermented foods in every single day, but they also appear to be beneficial. Optimizing your vitamin D is very important. If you haven't had your vitamin D tested, at least until you can get it tested, 2,000 to 3,000 international units daily. If you're taking vitamin D because you've had low vitamin D, make sure you're optimizing that. And as well for all of us in the plant-based community, making sure that we're getting adequate vitamin B12 from a sublingual methylcobalamin, 500 micrograms a day, 1,000 2 or 3 times a week is really beneficial to optimizing B12. And I know we'll talk more about exercise and stress and sleep later, but those are all important foundational principles to maintaining a healthy immune system.
You mentioned fermented foods, but even more fundamentally, I would think, is this a time we really should be focusing more on those whole plant-based foods and staying on the healthier side of the spectrum than gorging in junk? Like, how much of a difference does that really make at this time?
Yeah, that's a great question, Brian, and it makes a significant difference, huge difference, maybe more impactful than what we know. And I was just reading some of the news that was coming out around this COVID and how many people have quarantined themselves through social distancing right now, and they are watching Netflix and eating junk food, which is exactly the wrong thing to do during a season like this. But we see that, eating whole plants optimizes the immune system in quite a few ways. Number one, it impacts the microbiome, as we talked about earlier. The bacterial populations in our gut, including bacteria like lactobacillus and bifidobacterium and roseburia, those bacteria are really important for digesting the fibers in the whole plant foods. that we can't digest as humans. And as those bacteria digest the fiber, they produce these byproducts called short-chain fatty acids like butyrate. And those short-chain fatty acids improve our immune system, and they also turn off key inflammatory switches in our body. And so by eating whole plant foods, we optimize the health of our microbiome. By eating whole plant foods, the flavonoids and the phytochemicals in those plants also stimulate immune function and help us to fight infections and dial back inflammation as well. Other important plants like garlic and mushrooms, the shiitake mushrooms and raw garlic have been shown to really support the immune system as well and enhance our body's ability to fight infections. So eating a wide variety of whole plant foods, breakfast, lunch, and dinner, and removing especially those processed foods, animal foods, which change the nature of our microbiome. Removing sugar. Sugar can suppress the immune system and it alters the natural killer cells, those cells that are specific to fighting bacteria and viruses. And eating several tablespoons of sugar can suppress that function of your immune system for up to 4 hours. So removing that out of our diets is really critical, especially during times like this.
Great, thank you. Tell us a little bit about exercise. Some of us are in California being told not to really stay home, that kind of thing. What about exercise? Is that important for us to incorporate that when we can?
Yeah, there's some wonderful studies looking at exercise and immunity. And I was just doing a review today, PubMed and Google Scholar, and came across some really excellent studies. There was a randomized control trial in 2018 that looked at two groups of people, one that were exercising and another group that didn't exercise over the course of a month. And they found that the group that exercised consistently every morning had far more neutrophils and leukocytes in their blood than the group that didn't exercise. Now, what does that mean? So the neutrophils and leukocytes are really important because that's the active component of your immunity that would be responsible for fighting infections like COVID-19 or a flu virus or a bacteria that you might pick up from your children or someone at work. And it showed that those numbers were statistically higher in people that were exercising on a regular basis. We also know that exercise through other research has been shown to boost the immune function and to help our body fight off infections and recover from injuries. And so, exercise is a really important component of maximizing your immunity. It's also a great way to alleviate stress and to feel like you're taking some control back into your life. So this would be a really good time to turn off the media, turn off the news channels, turn on a positive audiobook or a podcast from Forks Over Knives or someone else, and listen to something that inspires you and activates you and moves you proactively into your future while you're exercising to move you in a direction of enhancing your immunity.
Thank you, Scott. Tell us a little bit more about personal hygiene. How do we maximize it? And tell us a little bit about the science behind it. Is there really science behind it, and does it work?
Yeah, personal hygiene does work. As we see with COVID-19, other viruses like the flu, these viruses are really passed through the transmission of bodily fluids. COVID-19 is believed to be passed through the spread of the aerosolized mucus particles from a sneeze or a cough that end up on hands or hard surfaces, and we pick those up. And it's interesting, I was reading in anticipation of this today, that on average, we touch our faces between 16 and 23 times an hour. And so the personal hygiene is really important, that if we are sneezing on surfaces, we're sneezing in our hands, we're shaking hands with somebody, we are passing those things along to other people. If they're not washing their hands or cleaning surfaces, then 16 times an hour, we're touching our mouth, we're touching our eyes, we're touching our nose. And it's an easy transmission of those viruses from one person to the next through these aerosolized mucus particles that are transmitted by hands. And so the science of hygiene it has a lot of credibility and a lot of support. And it's something that we all should really practice on a regular basis, and it's very important. And so it's simple things. Dr. Semmelweis, who kind of founded the concept of hand washing with mothers, pregnant mothers, really established the fact that hand washing saves lives. And in this case, with COVID-19 and the flu in the future, hand washing saves lives, and it saves people the threat of an illness. And so we should all learn to practice better hygiene. And that includes washing your hands under warm water for 20 seconds. And, just to get an idea of how long 20 seconds is, set your timer on your phone, put it up next to the sink, put some good soap and water on your hands and scrub them front, back, each finger, and watch the clock for 20 seconds. And that will give you an idea of how long 20 seconds really is. And I think for most of us, we do not wash our hands for 20 seconds. It's a little bit of soap on the palms, we wash them off and we're good to go. But this is a good opportunity for us to learn the benefits of good hand washing. It's one of the most important things that we can do. Secondarily, with coughing and sneezing, we've often been taught cover your mouth, so we do it with a hand, but then we don't go back and wash that hand. So the easier thing to do today is just to cough into your elbow. And that's a part of the body that's not often touched. And so coughing into your elbow is a wonderful way to prevent the spread of those mucus particles. Also, washing down surfaces is very important. And according to the CDC, there are substances that work to kill COVID-19 and other viruses and some that don't. We know that chlorine, Lysol, and 70% alcohol will kill the virus. Vinegar has been shown to be not effective. And the CDC does not recommend essential oils. And many of us in the health-related communities use essential oils for lots of things, but currently essential oils have not been shown to be effective against COVID-19. Face masks can be somewhat effective, although the CDC is not saying that that's the most effective way to prevent disease. Oftentimes when people put a face mask on, it's not fitted properly, so it's not covering sufficiently, and you still can get it through the eyes. And so the face mask may help, especially if you have symptoms. It's better to cover your mouth so you're not spreading them. But as far as covering your mouth to prevent getting the disease, it's not as effective. And then finally, during this season, and it's maybe good for us to recognize that hand shaking is not the best way to greet somebody, especially during this COVID-19 crisis. We can bump elbows, you can bump feet, you can do other ways to say hello, but at least this is a good way for us to protect ourselves and others.
Thank you, Scott. I'm going to move on to some audience questions. We have a question from Mia. Mia wants to know, if we must venture out to the grocery store, what precautions should we take?
Thank you, Mia. That is a great question. And at some point, we all need to go to the grocery store. And so, some good precautions are, number one, if you can go off hours, you'll encounter fewer people. And so that's a good way to try and, go with less busy times. If you're going to touch the handle of the cart, make sure you wipe it off first. They usually have hand wipes in the stores. I don't know if they have them in every store currently, but you can take some along, or you can take some 70% gel to wash that off. Also, with the products, the level of potential contamination for the products that you're getting at the store is really pretty low. If you have concerns, the CDC has recommended that you can spray them with like an aerosol containing alcohol or Lysol or chlorine. You can make your own spray with just a little bit of chlorine and water, and you can spray that. If you have a concern about the products you're picking up, you can spray them. With produce, it's always good to wash your produce when you bring it home with soap and water and soak it and then let it dry before you use it. If you're standing in line, try to create enough social distance, 3 to 6 feet, to just take care of yourself and others during that time as well.
Great, thank you, Scott. Let's see, Leah wants to know, is age really a factor if you don't have any underlying conditions? I eat 100% whole food, plant-based diet and exercise daily. So yeah, so Scott, I've actually heard that question too, from actually some of my own family members too. Like, hey, I'm in the older population. I eat great. I have no underlying conditions. I'm not on any medications. Am I actually really safe? I'm just old. I'm just older, but I'm not sick in any way. Am I safe?
Yeah, that's great. And kudos to you, Leah. That is fantastic. That's really how the population should be. As we mature, we should be healthy and strong. The data, we just don't know the outcomes of that, but I would hypothesize, and I believe, that if you are in that more mature population, even 70 to 80, but you don't have disease, you are healthy, exercising, eating a plant-based diet, I sincerely believe that your risk of being impacted significantly by the disease is very, very low, and perhaps, you know, about the same as that population from 40 to 50 or 60. So, and that would highlight the importance of those, a healthy lifestyle. You know, as we look at those higher numbers in the 60 and up population, we also know that that population, at least 75% to 80 of them are facing chronic disease. That's where we see all the heart disease, diabetes, and cancer. And so more than likely that higher number of deaths and severe disease in the aged population is due to the fact that they're facing these chronic disease and on multiple medications or polypharmacy for the management of their disease. So Leah, I do not believe that you have a significant risk, but just keep doing everything that you're doing to be healthy and well.
Thank you, Dr. Stoll. Cisco wants to know, how can I convince my teenagers to stay home? Of course, we all remember those pictures from Florida from a couple of days ago, everybody partying on the beach. So, so yeah, how do we do that, Scott?
Yeah,
maybe this is an unfair question.
No, we have teenagers in our home, so we know some of the challenges of working with teenagers. And, you know, I think this is a great opportunity for us to have, as parents, to have honest and real conversations with our teenagers. And rather than just telling them what to do, trying to teach them and educate them about how to make better choices, and to educate them that this is not just about them acquiring the disease. This is actually about them being a part of a community that's preventing the spread of a disease. Because, you know, it's very possible for a younger person to be an asymptomatic carrier of COVID-19. And so unintentionally, they could be out in the community spreading COVID-19 and infect other people who are vulnerable. And so, you know, what I would teach my children is from a place of compassion and concern for those that are vulnerable in our community, especially the older population that's facing disease. We need to do our best to protect them, and we don't want to put them at risk. And so here are the things that we need to do as a family. Here's the thing that you can do as a teenager to protect those people that are vulnerable. And it's kind of our social responsibility to protect them by not going out and you know, being in social situations where you could spread the disease. And so, you know, as a family, I would say this to my family, as a family, we've just decided during this season that we are going to make some changes, learn some new things, learn a new language. We're actually going to do this as a family. We're going to do 2 weeks of some webinars and study as a family. And we're encouraging our children to take this time to pull back and learn some new things, but also recognize that they're a part of the solution for this COVID-19 crisis.
Great. Nan wants to know, how do you best protect yourself if you need to go outside? What precautions should you take before you leave and after you return?
Yeah, so, you know, the recognizing that COVID-19 is probably and likely spread through aerosolized, you know, bodily fluids. Being outside, there's really no inherent risk if you're out alone. If you're in a large group of people, you want to make sure that you're outside of that group by at least 6 feet, that you create some social distancing space for your own health and for the health of others. You know, it's likely unnecessary to wear a mask unless you're going to be in a situation where there's tight quarters. If you're going to a hospital where you would need, or a doctor's office, then it might be important to put a mask on and practice social distancing, and be very careful with where your hands are to make sure that you're washing your hands after you've touched something and you're not touching your face. And again, I just want to stress how important that is. If we're touching our face, you know, 16 to 23 times an hour, we really have to work hard to not touch our face when we're out and about, and to work on, you know, holding your hands like this or putting your hands in your pockets just to prevent that facial touching, because that's a way that the disease could be spread. So, but just to go outside, I don't think there's really inherent risk, and to practice social distancing, I don't think there's any inherent risk as well.
So we have a lot of people asking, Dr. Stoll, is it safe to eat fresh vegetables and fruit? I'm concerned that someone with COVID-19 may have touched them.
Yeah, so we'll put a little bit of, I guess, data to this too. If we look at current statistics, you know, we have about 350,000, 360,000 people globally that have been impacted by the disease out of 7 billion. We also know those numbers are probably very low because those are only the numbers that we've tested so far. But you know, the likelihood of the fruits and vegetables you're eating being contaminated by statistics are very, very low. However, you know, taking your fruits and vegetables home and practicing the same good hygiene by washing them for 20 seconds with warm soapy water would be sufficient to eradicate any of those viruses that may have contaminated them. And so, yes, I would certainly take those home, wash them, and then let them dry, and they should be relatively safe to eat. I don't think there's an issue. Certainly vegetables, when we're cooking them, washing them and cooking them, there's also a very low risk. But there's also a great benefit in eating those fresh fruits and vegetables to improve your immune function, so you certainly don't want to neglect those either.
Sonia wants to know, does an annual flu shot and a pneumonia shot help against the COVID-19 virus?
Yeah, that's an excellent question, and a lot of people have asked that, so thank you for bringing that up. And you know, COVID-19 is a new virus. Actually, you know, corona means crown or king, because when they look at the outside of the virus, it looks like a crowned virus. And so this is really a new virus that's brand new to the population. And so the previous immunity that we may have gained from other immunizations will not have any impact against the coronavirus. So this is going to be something that over time we develop immunity to, and eventually, as they're working on right now, the number of companies that have vaccines ready for testing in the next month or two, but in the next 12 to 18 months, there will likely be a vaccination for coronavirus, especially for that vulnerable population that will help them to ward off the disease. But at least for now, none of the vaccines are going to be of benefit to us. This is a new experience for the human population and a new virus that we'll have to gain immunity to through vaccines and exposure over time.
All right, Jen wants to know, how does fear and anxiety, which a lot of us have obviously these days, impact our immune system, and what can we do to overcome that?
Jen, thank you for asking this question. This is so important, and it's something that I really wanted to address on this webinar, so I appreciate that question. Thank you. You know, when we look at the research on fear and anxiety, we see several things that fear and anxiety in the research have had a strong association with suppression of the immune system and a greater likelihood to get infections. A large meta-analysis also showed, looking at more than 300 studies, that when people have chronic stress, chronic fear, and depression, that it reduces their cellular and their humoral immunity, the very types of the immune system that are responsible for fighting infections and viruses. And so we see during this time, as coronavirus has spread across the globe, that it has also gone with this fear that has been ramped up. And if you watch the media too much, it's very easy to fall into the fear of coronavirus. But I want to cast some hope around this, and I want to encourage you to disengage from fear and to move in the opposite direction of fear. And I'm going to share with you how to do that, because we don't want fear in our life. I often learned that fear is the false expectations appearing real. So it's an anticipation of an uncertain future and the dread that something might happen. And so some of the ways that we can overcome fear in our lives, we can retreat back to what we know now. And that's why I started out our webinar looking at some of the data and the facts. We can go back to the facts and understanding what we know about COVID, what we know to be true today. We're also looking at the facts and the science today of how to maximize our immunity and how to prevent from getting the infection in the first place. And we're also learning the facts today that when we have a healthy lifestyle and we're eating a whole food plant-based diet that's rich in plants and that contain phytochemicals and antioxidants, that our immunity is boosted and we have a very low susceptibility. So this science and this data and facts really helps us to overcome fear. And also, I want to encourage you that through disengaging from fear, we engage in hope. And hope does some very powerful things. The research on hope is very interesting. When they do functional MRIs of people's brains and they look at the effect of hope, hope actually turns on multiple centers in our brain that begin planning a future and strategizing how to get there. And so rather than retreating into fear, we start looking hopefully at the current circumstances and into the future. Now, this is not ignoring what we're facing today and the crisis and the pandemic and the challenges that we're facing, but it's looking at, you know, the positive aspects of making better lifestyle choices. And it's also looking at the hope of the future that we will get through this crisis. We will overcome this crisis. There will be an end to it, and we will be moving forward. Things will not necessarily be the same. Some things will be better. Some things will be affected negatively. But as we move with hope, we actually begin to see possibilities and potential, which is very, very important. And our brain will begin shifting out of, you know, contracting down and pulling in, which fear does, into expanding and looking at potential and possibilities and making proactive choices. So I want to encourage everybody on this webinar and anybody that's listening to this afterwards to disengage with fear and to move in the opposite direction by going back to science and data, going back to the choices that you can make every day and knowing that you're making healthy choices and you're doing the right thing and you're maximizing your potential. And by looking at the hope aspects of the future, the possibilities, potentials, and some of the really beneficial ripples that are going to come out of this. For example, I just was talking with somebody that has a business making fermented vegetables, and they were telling me that their sales are up 300%. You know, the searches on Google that looking for ways to enhance your health have gone up tremendously. So I'm hoping that out of this, one of the positive ripples that I'm hoping will come out of this is that people will recognize their diet is important, eating plants is important, taking care of yourself, making wise lifestyle choices is really critical, and that we'll see a wave of health move into the future.
Great advice. Thank you, Dr. Stoll. Beverly wants to know, if you have the coronavirus once, is it possible to get it again?
Yeah, that's a great question, Beverly. And I know there's been some suggestion of that, maybe out of China, where they've had patients that, you know, had tested positive, came back out and appear to have gotten that again. And so this is all science that's kind of underway, and we don't know for sure. We don't know the mutation rate of the COVID. We don't know if people are testing positive for one variety of COVID and then getting a second mutated version. But again, you know, the things that we do know, and this is where we kind of fall back into this, where we don't, if we don't know the solid answer to something like that, because the science is still being developed, we fall back to the things that we know, that if we take care of ourselves, we can maximize our immunity. And when we're healthy and strong, even getting it a second time is unlikely to cause significant problems.
Thank you, Dr. Stoll. We have a question from someone wanting to know, as a healthcare worker, what are some other means of keeping myself safe from bringing the virus home to my family?
Well, first, thank you for being a healthcare worker in this environment. I know it is incredibly challenging. I have many colleagues that are facing these challenges of the stressful environments of hospitals, the deluge of patients through the emergency rooms. So I just want to say thank you for all of your work and for helping so many people. We really appreciate that. You know, it's important as you leave the hospital, a few things that would be really critical. Have hospital clothes and home clothes. And so you change, obviously lots of people change into scrubs when they arrive at the hospital, but not to wear the same clothes home that you worked in, and including shoes, to leave all of those things at the hospital. Again, proper hygiene. If you have the opportunity to shower before going home, that would be optimal. Certainly hand washing, and then having wipes even in your car to just wipe down surfaces before you go home would also be really important. And in those ways, and I know as most hospital workers have been recommended to wear eyewear, masks, and in some cases more significant outerwear to protect themselves. You know, all of those are recommendations hospital by hospital, but those protective elements are very important. Again, you know, not touching the face, I want to stress that, because after reading the statistics of, you know, how many times an hour we touch our face, it's really important to break that habit. so that we're not infecting ourselves and infecting others. And then again, just really work to keep yourself healthy. One thing that we haven't talked about, but I'll just mention briefly, and we don't need to go into a lot of detail, but making sure that you get a good night's sleep is really important. 7 to 9 hours a night really helps to restore the function of the immune system. So turning off technology and TVs and getting to bed at a reasonable hour and getting a good night's sleep is also really important to your health. So thank you for that excellent question.
Thank you, Dr. Stoll. Rick wants to know, do type 2 diabetics have a weaker immune system, and are they more susceptible to the COVID-19 virus?
Yeah, thank you, Rick. That's a great question, because we have so many people globally that are fighting type 2 diabetes today. And so yes, the data does show that people that are living with type 2 diabetes are at a greater risk for the disease, because the immune system is somewhat compromised in people that have type 2 diabetes. So it's a really good opportunity during this season to kind of double down on a healthy lifestyle. And that's one of the things that I decided as this was kind of ramping up. I said to myself, you know, I'm going to double down and make myself even healthier during this season. And so if you're someone that's living with type 2 diabetes or type 1 diabetes, it's a really important opportunity and an important reminder that now is the time to really go for it with a healthy lifestyle. And the good news is for people living with type 2 diabetes, that a healthy lifestyle with a whole food plant-based diet as the foundation and some exercise can send type 2 diabetes into suspension and remission. And so by just taking 2 to 4 weeks, you know, between now and April, I would encourage everyone with type 2 diabetes to, you know, log into the resources at Forks Over Knives. We have great resources at plantricianproject.org and seek out a really aggressive diet and exercise lifestyle intervention in the next month, and you will see an incredible improvement in your insulin resistance, reducing medications, but you'll also be decreasing the potential of encountering COVID-19 or having more significant impacts from that disease if you happen to get it.
Great. Kathy wants to know, why do you think the virus is hitting Italy so hard? And how can we avoid that kind of outcome in the US and in other countries?
Yeah, thank you. It's a good question. It's something that I was researching today. And it appears that from the epidemiologic data that Italy was slow to close their travel to and from China. Other countries, including the US, acted a little more quickly to close down those travel channels to and from China. And that appears to be at least one of the reasons why Northern Italy is more impacted. I think in the coming months, as we begin to study this and people are looking at more of the data, we may discover other reasons, but it really appears, at least at the first outset, that it was the number of people traveling back and forth between China carrying that disease. And as we talked about at the outset of this webinar, you know, it spreads very quickly with that spread rate of about 3 people, so that in 10 contacts, 10 people spreading it, 59,000 people are impacted. So.
Great, thank you, Dr. Stoll. We have several people asking whether or not they should be wearing masks when they go out shopping. What do you say to that?
Yeah, so it's an excellent question, and I think what I was reading today, CDC, WHO are recommending that if you're healthy and you're going out, they're not encouraging you to wear masks for several reasons. Number one, they want to preserve the masks for healthcare and healthcare workers. So a part of our responsibility as a community is to preserve those resources where they're really needed, which is in hospitals that are facing this, they're on the front lines of this every day. And so for those of us that, you know, are not actively sick, it's better to preserve those resources for hospitals. Also, you know, as we talked about at the outset, you know, the spread risk of this is about 3 to 6 feet. So somebody coughing, sneezing, you would have to be within 3 to 6 feet in order for them to directly infect you. So by practicing social distancing again and keeping kind of a 6-foot window around yourself, you're also kind of insulating the space around you from the potential of being infected. And as I mentioned in the one question, kind of going off hours when there's not as many people there also lessens the likelihood. And something that people often forget is that you may cover your mouth and nose, but you still can get the infection in through your eyes. And so the mask is not an insurance policy against getting the disease. And so I really recommend only wearing the mask if you are sick and concerned about spreading something to someone else.
Thank you. Lori wants to know any plant powders we should get in case we run out of greens, spirulina, chlorella. And I'd also add, Dr. Stolz, we're seeing a lot of questions about people wondering about things like vitamin C, if they should take vitamin C at this time, any other supplements. What say you?
Yeah, so thank you. You know, I have always been a proponent of just eating as many plants as you possibly can. The data on supplements is variable. Even vitamin C, you know, may or may not help significantly. We do know that eating a whole food plant-based diet will improve your immunity significantly. So if you do want to add vitamin C, I always encourage you to get it from a whole plant source, not to get a commercialized version or industrialized version of vitamin C. And there are some supplements out there that are whole plant sources of vitamin C. But if you're eating lots of leafy greens, if you're eating some citrus fruits, if you're eating lots of berries, you're going to get a wide array of all of the minerals and vitamins that are necessary to really support your immune system. When you can afford it, organic produce has higher levels of especially antioxidants and can be beneficial in those cases. If you're having challenges finding some of these fruits and vegetables, a couple of options. You can buy frozen. Frozen still contains a lot of the nutrients and sometimes more nutrients than fresh. There are some powdered products. Again, I try to be careful with those. I look for whole plant sources of the powders. There are things like barley and some of the sprouts that are made into powders as a supplement. But really the goal is to try and get as many greens as possible. You know, we've tried to go to a couple of different places just doing some research. There's some, you know, outlet stores where you can buy frozen kale. You can go to Costco and other places to get frozen kale and frozen greens. And you can also grow some in your own house with just some organic soil and some seeds. In about 2 weeks, you can start growing your own lettuce. You can grow your own kale just in a windowsill. So, you know, since we all have some extra time, this might be an opportunity for us to learn how to do some indoor gardening and grow some of our own produce, which is incredibly rewarding. And you know that it's the cleanest, healthiest, and safest produce that you can possibly consume.
Great, thank you. Paul wants to know, is it true that the virus is heat sensitive? We've heard that there's been some kind of conflicting reports that when the summer rolls around, you know, this is all going to go away. We know, I think from some things I've read, Dr. Stoll, is, you know, the flu, for example, tends to die down in the summer. Can we expect something similar with coronavirus?
You know, I think this is all still very new. This is a brand new virus. I just want to reiterate that. I'm touching my face. I have to learn to not do that. So this is
I did it about 8 times during this one. You made me very conscious about it, for sure.
I know that. So it just tells us how important that is for us to break that habit, right? So, you know, this is a brand new virus. And I think that, you know, looking at some of the other data, it appears that it may be sensitive to heat, but we don't know for sure. Certainly in some of the warmer parts of the world, it still is present and still appears to be spreading. And I think only time's going to tell how much that will dissipate as we go into the summer. Certainly we hope and pray that it is heat sensitive as we hit the warmer summer months, that it will dissipate. And that's, I think, all of our hope and prayer that will happen.
Rodney wants to know, how long do the symptoms last after I get, if I were to get coronavirus, how long would those symptoms last?
Yeah, it typically looks like, you know, the virus lasts about 14 days, maybe 21 days. There's an initial period where people are infected, but asymptomatic. And I think that's one of the challenges with COVID-19 is that, you know, the first even 5 and sometimes even up to 10 days, you can have very few symptoms. And so that's why it appears to be very infectious, because people don't know they're sick. The symptoms can last for 2 weeks, maybe even up to 3 weeks if you're fighting the symptoms. And then for people that end up with the severe cases, they are hospitalized in the ICU. Sometimes that can be up to a month. But the recovery from that is also, relatively high for the people that enter the hospital. A large percentage of those are actually discharged to home through supportive care in the hospital. So.
Great, thank you. We're going to take 1 or 2 more questions. We have a question from Rich. We hear that some people test positive but have no symptoms. How long can they infect others? And he also has another question. Can our pets get the virus from us?
Yeah, that is a great question. The zoonotic spread from animals to humans appears to have, been the initiating factor for this, which again, highlights the importance for moving more toward a plant-based diet, not consuming, animals as a primary source of food, or eating animals at all, would certainly eliminate some of these zoonotic spreads of viruses. And, the infectivity from human to pet is, it's hypothetical at this point. And so I think people are encouraging those that if you have pets and you have the coronavirus, to be careful, or to maybe send them out. But I don't know that it's been, the direct passing from humans to pets has been substantiated and identified as a percentage, something that we consistently see.
There was also, let's see, we hear, okay, now we're going to move on to Amy's question. Should we be concerned about being around immunocompromised individuals, those that are undergoing chemotherapy, for example, if we have no symptoms?
Yeah, I think we need to be very careful protecting the vulnerable part of our population. And so for those that are immunocompromised, those that are fighting diseases like heart disease, type 2 diabetes, cancers we talked about at the outset, we need to be very, very protective of those people and limit the number of people coming into contact with them. And so even if you're asymptomatic, we know that, the first 5 and even up to 10 days of COVID-19, you can be asymptomatic and a carrier and transmitting the disease. So even if you're asymptomatic, we need to be very careful and limit those exposures, and only come in contact with those people if we're a primary caregiver, or if we're just, visiting them from a distance. But, this is a time when we really need to protect the vulnerable people in our society.
Great. We're going to do one more question. We have a question from Mike. What is the rate of false negatives from the existing tests that we have today?
Yeah, Mike, that's a great question. And I actually do not know the answer to the false negative tests currently. And I would have to look that up, and I can maybe follow up with Brian on that later. Because I didn't see, I was looking for some of that data, and I didn't see good data on that to understand how many false positives, how many false negatives. And I think we're still learning that with the different types of tests that are being used. But it's an excellent question, and I'll do some more research on that. And if I find a good answer, I'll drop that over to Brian. He can put that
Thank you. We will send a follow-up email to everybody here today. We'll also be providing a link to a replay of the webinar, which will be available for the next couple of weeks as well. And we'll also include some links, like some CDC links and other places where people can get some information. So I just wanted to say that. So great. And yeah, well, Scott, this concludes our Q&A session. And I just want to say thank you so much for joining us and for all the great work you do to help people live healthier and happier lives. And to our wonderful audience, thank you for being with us today. We hope this webinar was helpful, and please know during this difficult time that we are here for you. You can visit our website and browse our free recipes and content. I also invite you to join our online community on Facebook. It's called the Forks Over Knives Official Plant-Based Group. We have 330,000 members in that group. It's a free group. You go in there. you exchange ideas and insights, and it's just a great place for us to be with one another. I also want to just thank all the people, all the doctors that are on the front lines, helping us be safe and dealing with this in a quite a dangerous way, and at great risk to themselves. So please be healthy and safe out there, and have a good afternoon and evening, and we'll catch you again soon. Thank you very much.
Thank you. Have a great evening.